This study is titled Anxiety and Depression Prevalence in Free Clinic Patients and was conducted in the JayDoc Free Clinic in Kansas City, Kansas. 1 in 3 individuals will be affected by depression, anxiety, or somatic disorders within their lifetime. 5 to 10% of individuals who visit a primary care provider are affected by depression. However, it is only recognized in 50% of those patients. Low-income communities are at high risk for compromised mental health across their lifespan, and poverty is directly correlated with poor mental health outcomes. Things like poor housing, limited resources, high rates of crime and violence, and inadequate educational systems place strain on individual mental health and lead to greater disparities.
The primary study outcome was to assess the prevalence of depression and anxiety in the JayDoc Free Clinic patient population. Our secondary outcomes were to compare the screening outcomes among various demographic groups, including gender, race, income, and insurance status using validated surveys, to prove the need for accessible and affordable mental health services for this patient population, and to establish a permanent standardized method for surveying patient mental health status. To carry out the study, we distributed GAD-7 and PHQ-9 questionnaires and demographic surveys to all JayDoc Free Clinic patients that were older than 12 years old. The GAD-7 and PHQ-9 questionnaire scores were categorized into minimal, mild, moderate, and severe symptoms.
Demographic variables that were surveyed included household income, gender, insurance status, and ethnicity. After collection of the surveys was completed, there were 232 total participants, and of those participants, 222 completed the GAD-7 questionnaire, and 228 completed the PHQ-9 questionnaire.
Based on the results, the JayDoc patient population had higher percent distributions in the mild, moderate, and severe categories for both the GAD-7 and PHQ-9 surveys compared to 2019 CDC National Health Survey data. The graph on the left depicts the GAD-7 symptom classifications of the JayDoc patient population, represented by the blue bar, as compared to the CDC National Health Survey data, represented by the gray bar. You can see that the percent distribution of patients reporting symptoms of anxiety was higher across all symptom categories. The graph on the right depicts the PHQ-9 symptom classifications of the JayDoc patient population, represented by the blue bar, as compared to the CDC National Health Survey data, represented by the gray bar. You can see that the percent distribution of patients reporting symptoms of depression was higher across all symptom categories. Out of the 232 participants, 54 of them completed the demographic survey, and that data was assessed.
Based on the data analysis, no correlation was found between PHQ-9 scores and GAD-7 scores. There was also no correlation found between PHQ-9 scores and GAD-7 scores with the demographic variables that were surveyed, including gender, household income, insurance status, and ethnic background. In conclusion, the overall prevalence of moderate and severe depression and anxiety were greater within the JayDoc Free Clinic population compared to national averages found by the CDC.
The findings from this study support the need for established, permanent, and routine mental health screenings at JayDoc, along with increased access to mental health resources for all demographic groups within this patient population.